Peri-implant soft tissue as opposed to periodontal, there are some major differences, and among them the lack of connective tissue attachment in implants, absence of periodontal ligament blood supply, hypovascular, hypocellular connective tissue zone adjacent to the implant. And next, please. And we are going to talk a little bit about everything because we have to take into account the comparative anatomy of periodontal and peri-implant soft tissue. As you remember, the blood supply comes from mostly from gingiva and less from the bone. And here we are. Next, please. And here we are while measuring the attached gingiva, as it has a tremendous clinical importance. The height of the attached gingiva is dictating the long time prognosis of our implants. And next, please. Now, it is of a very big importance, the presence or the absence of the keratinized attached gingiva, because it is avoiding the spread of inflammation to tissue underneath. The blood supply supports bone, prevents recession, and permits better brushing. Next. And here we are, while considering the several phenotypes of the gingiva, less than 1.5 millimeter and more than 1.5 millimeter, which are indeed, as I told you before, of a tremendous importance. And next, please. Now, the problems with the thin biotype, and I can tell you honestly that we had cases with a thin biotype like this, and the people wouldn't apply, to monitoring, because we are asking our staff to call all our patients from time to time to remind them it's time to come to, make some maintenance, to remove the prosthetics, to hygiene, to take some measures if we are seeing the least recession sign. But unfortunately, not all the people are responsive. So next, we have this thing of the soft tissue, and it is a lot of literature on this. Initial gingival tissue thickness at the crest may be considered as a significant influence on marginal bone stability around the implants. And the next, please. So in patients with deficient tissue thickness, a roll flap or a repositioning flap technique can be considered, as well as reshaping of the gingiva after this. Next, please. And you can see if we are doing procedures like this, we can give a better aesthetic result. We can improve the immediate loading and the success of the implant, the long-term prognosis, and we are preventing future mucosal recession. Please, next. And here we are with some cases on mucosal surgery. Next. So the term mucosal surgery is referring on situation with lack of attached gingiva, shallow vestibules, and the frenum. I mean, we are doing frenectomy as a standard procedure. Step 2, after the consultation and establishing the treatment plan, frenectomy. Always, always, always. Next, please. And here you can see some clinical situation where it was done correction of the periodontal pockets, crowd lengthening, ridge augmentation, aesthetic surgical connection and coverage of the denuded root surface. Next, please. And we can use free gingival autograft, subepithelial connective tissue graft, either as a flap or tunnel. And here is our beautiful team. And next, please. The rationale of using free gingival graft opposite to connective tissue is that its behavior is by far better. And you can see situation with subepithelial connective tissue graft versus free gingival graft. Next. And those grafts are used to enhance the keratinized attached epithelium and improve the soft tissue contour. Next, please. You can see as this case we have a mucogingival defect on the tooth 35. And next, please. And we revealed the graft from the palate as here it is, the graft into the site. And we used also PRP, PRF. And next, please. And here we are, day 2 post-operatory with the revascularization of the graft. And next, please. The epithelium undergoes degeneration and it's replaced by new epithelium. An impressive picture, indeed impressive. Next, please. And we have a very, very, very nice final outcome. Here we are with the healing of the graft. And the next, please. And we had to reshape it a little bit because it was a little bit too thick. And next, please. Here we are with the gingivoplasty, which we've done, as I told you before, reshaping it a little bit in order to have this aesthetics as all the gingiva around. And next. And here I am while getting an interesting prize on some of our scientific manifestation. Thank you. And next. So we have here initial situation and the final. Next. And here we have another interesting case, a patient which was referred to us by a colleague from other city. He lost his frontal teeth in an accident, but together with the alveolar bone. So it was a lack of bone. This was the intraoperatory situation. So we grafted it. Next, please. We grafted it with a block of bone, which we removed from his menton side, you can see, using piezotom. And here is the site, the second operatory site. And here is the block fixated on the alveolar bone, maxillary alveolar bone, with screws, regular screws. Next, please. And 2 weeks later, he has got a beautiful healing. And next, please. And we used, of course, we are using as a routine PRP and grafting. And here we are with some beautiful colleagues. There are people which I'm so grateful I have around. And next, please. Of course, my daughter. Many years before when she graduated university. And here are the instruments. And next, please. It's no secret how we are manufacturing it. PRP, PRF. Next, please. So those are the pictures. I mean, pre-op, the donor tissue, split thickness flap while we are harvesting, and the donor tissue inside. And we are taking care of everything while using those membranes made from PRP, PRF. Next, please. And in this situation, we used a palatal stent. Next, please. And here we are, 1 day post-operatory An amazing result, result, even though the site of the operation was quite big, but the patient didn't feel not, you know, some unexpected pain. He was very compliant, so it helped us a lot. And next, please. Here we are 1 week post-operatory and 2 weeks. An amazing healing also on the palate, as you can see. And next. Some technical details about the connective tissue graft, and I thank you with this.